All right. So, welcome you all. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester. I am the founder and CEO of Your GPS Doc. And just in case we have some newbies listening to this now live, or those of you who may catch the replay, let me just do a slightly more formal introduction. So, I am a board certified pediatrician. I am a former caregiver to my dad, and I'm an independent health advocate and the owner of Your GPS Doc LLC. And I primarily work with family caregivers, helping them navigate the complicated healthcare system for their loved ones. And I was inspired to do that and to start my company as a result of my experiences caring for my dad. And so if you want to know more about that, you can go to my website, yourgpsdoc.com, and go to the About page, and you can read a little bit more about my journey. But I actually left clinical medicine in 2017 to become an independent health advocate and to help other family caregivers, because I saw just how ridiculously crazy it was to get my dad the care that he needed. And I saw that my professional influence and knowledge was very, very beneficial. And I thought that that was great for us, but it was unfair for everyone else. So now I bring knowledge and inside tips to individuals and their family caregivers so that you all can be your best and your strongest advocate in medical settings. So every Monday night at 8 p.m. Eastern Standard Time on my Facebook page, which is Your GPS Doc, I do Navigator Nuggets, and we talk about all types of things related to navigating the healthcare system. So I had a completely different topic scheduled for today, but when I woke up this morning, there were tons of articles in my email inbox from the various news outlets regarding coronavirus. And of course, unless you've been under a rock, this has been the case every day, right? There have been lots and lots of updates and news breaks and things like that related to coronavirus. But again, as an independent health advocate who primarily works with family caregivers, I really chose not to say much over the last few weeks about coronavirus for several reasons. And these actually serve as my disclaimers today. So I am not an infectious disease expert. I am not a public health expert. I'm not an epidemiologist. And I'm not doing a lot of clinical medicine these days. But this morning, when I woke up, there was an article in Kaiser Health News, and it's been reported in CNN and all the other major news outlets, describing multiple deaths in a nursing home in the state of Washington. And that's what prompted me to do this episode of Navigator Nuggets tonight, because I know that many in my audience have elderly parents, elderly grandparents, other family members who are in skilled nursing facilities, otherwise known as rehab facilities or skilled or nursing homes. And I know that this impacts a lot of individuals in my audience. And so I really thought that it was important to bring this information to you, really with a slant geared towards family caregivers. And whether your family member is in a facility or whether they are at home with you or at home living on their own, you will find this information valuable. And I will add that even if you're not a family caregiver, you will find this information valuable, because we're going to start with a general overview of coronavirus. Okay, so that's why we're talking about this today. So, if you are new, welcome. Please come back next Monday. Again, every Monday night at 8 p.m. on my Facebook page, we do Navigator Nuggets. So another quick warning, this episode is going to be a little bit longer than my normal ones that have been, 10, 15 minutes or so. Okay. All right. So let's go ahead and get started. So let me give you some background about the coronavirus. What is the coronavirus? So coronaviruses are a large family of respiratory viruses. Okay. And these viruses are common in both people and in animals. And very rarely do they go from animals to people. But that's what we have seen, not only with this novel coronavirus, which is being called COVID-19, so all caps COVID-19, which just stands for coronavirus disease 2019, okay, because it was discovered in 2019. But we also saw this with SARS. So those of you who may remember the SARS outbreak and the MERS, MERS outbreak, those were also coronaviruses, okay? So this is a virus, and it is a respiratory virus, and it is thought to have started, or it has started, it did start in China. And there was a live animal market in Wuhan, in a province in China. And, the animals were felt to be infected. And then that was spread from animals to people. And now we are seeing people to people spread as well. Okay. So let's just go through a quick timeline. So I talked to you about when it started over in China. Initially, the only cases that we were seeing here in the United States were in individuals who had traveled to that particular area of China. But as you all know, that is no longer the case, okay? And so now we are seeing person-to-person spread, both, in China and across other countries, okay? So during the week of February 23rd, the CDC reported the spread of the virus throughout California, Oregon, and Washington, okay? And the very first death from coronavirus 19 or COVID-19 actually was in the state of Washington, okay? You may remember that there was a Princess Diamond cruise ship and, that had traveled to China, and those passengers were quarantined, I think, for a couple of weeks on that ship. And on that ship, the cases went from 10 all the way up to 700 cases, okay? And we're gonna talk a little bit more about that, but that just demonstrates how easily transmissible this coronavirus is, okay? So I'm gonna share with you some latest numbers, but keep in mind, when I say latest, this is as of 6:00 p.m. Eastern Standard Time today, which is Monday, March 2nd. And the reason it's important that you know that is that literally, you guys, as I have gone back to the websites over and over again today, like CNN and CDC, there are updates where literally 30, 45 minutes, 50 minutes, and the information is changing. So it is possible that what I'm sharing with you right now may not even be the most up to date, because I decided after 6 p.m. I was going to stop checking because, it just got to be incessant. But please know that this is a fluid process. And like I said, there were updates within 30 to 45 minute intervals. Okay. So the latest numbers. So this novel coronavirus has killed more than 3,000 people worldwide. Okay. More than 3,000 people. Now, the vast majority of these deaths have occurred in mainland China. And there are now 88,000 global cases, okay, across the world. Now, this virus has now been detected in every single continent except for Antarctica, okay? That's huge. Every continent except for Antarctica, okay? It's known to be in 58 countries. And there are, as of, again, 6 p.m. Eastern Standard Time on March 2nd, there are 100 cases here in the United States. 48 of those cases were from repatriated citizens, okay? And then the other 52 were from people living in the United States and in 11 states. So let me just go through those states, because I know that you all may be watching from all over the country, all right? So we have seen cases in Arizona, California, Florida, Illinois, Massachusetts, New York, Oregon, Rhode Island, Washington State, Wisconsin, and New Hampshire, okay? And there have been 6 deaths in the United States as of 6 p.m. Eastern Standard Time on March 2nd, 6 reported deaths, and all 6 of those deaths have occurred in Washington State, okay? All right, so what else do I need to tell you? Initially, like I said, the cases were all kind of tracked back to people who had either traveled to China or who had known contact with someone else who had traveled. But again, now we are starting to see what's known as community spread, which means that people are being infected and it's not always clear where they caught the virus, okay? All right, so the reason that I am talking with you about this today, as I started with in the intro, is that all 6 deaths have occurred in the state of Washington, and 4 of those 6 deaths are in either current or former residents of a life care nursing facility, okay, or nursing home. So that's what really grabbed my attention this morning, because, that is like a hotbed for spread. And we're going to talk about why that is true, but it is very, very worrisome. And the experts are very concerned about this outbreak that is currently occurring in the state of Washington. And we know that something very, very similar can happen across the country in other nursing facilities, okay? And so that's why I wanted to talk with you all about that today, all right? So I'm not going to get into the details about the individuals that have died, other than to tell you that the 4 that were residents of this nursing home, or former residents, one was a man in his 70s, one was a woman in her 70s. I'm sorry, 2 were men in their 70s. One is a woman in her 70s, and one is a woman in her 80s. So for those of you who are young, like me, you may be feeling reassured, like, oh, it's just older people. But the 2 people who were not connected to this life care facility that died in the state of Washington from coronavirus were a man in his 50s and a man in his 40s, okay? And unfortunately, we don't have a lot of additional information about those 2 patients that succumbed to their illness, okay? Now, right now, the experts are estimating that there is a 2% mortality rate from coronavirus. Now, I need to explain, 2% may not sound like a lot, but to those of us in medicine and healthcare, 2% is high. Just for reference, the mortality rate for flu, influenza is like 0.7 to 0.9%. But a word of caution, this is overestimated. The reason it's overestimated is that when we calculate rates, like mortality rate, we're basically, think back to your fractions, we are in the numerator, you have the number of people that have died, and in the denominator, you have all of the people with the disease. So this is problematic. This 2% number is problematic because we don't know all of the people that are infected with this disease. We still are not up to par in terms of our ability to even test for coronavirus. This is not something you could just walk in any local emergency room and say, I want to be tested for the coronavirus, okay? The hospitals are now in the process of coordinating with the CDC. So the bottom line is that the number that they are using for that denominator only includes the people that we know have tested positive for coronavirus. There are many more. I mean, we don't even know how many more people are truly impacted by coronavirus, because some of the individuals are completely asymptomatic. Some of them are having mild symptoms. We're going to talk about the symptoms in a moment. And many of them have not been tested, okay? Some of them will never be tested, and some of them have not yet been tested. So that's why that 2% number is a little overinflated. But for what it's worth, that is the number that is being quoted right now, okay? All right, so let's talk about the symptoms of coronavirus. So coronavirus, as I stated, is a respiratory virus, okay? And it is very similar to the cold and to the flu. In fact, the symptoms of coronavirus can be indistinguishable from the flu. So when I go to some of my tips later, you're going to understand. Just remember this point. It is very similar to the flu, okay, in terms of its symptoms. So you can start out with just a little bit of a sore throat, some nasal congestion. And then what happens when it becomes more serious, if it becomes more serious, is that it can progress and move into your lungs and cause pneumonia. And so those patients will have fever and cough and difficulty breathing, shortness of breath, okay? And so generally the patients that have died, as far as what we know, have died from complications of coronavirus, which typically includes pneumonia. And so once the mucosa in your lungs, once your lungs are infected, you are no longer able to exchange oxygen and carbon dioxide appropriately. And so basically your organs begin to shut down, you're not getting appropriate oxygen to your body, and you die, okay? But it can start out just like body aches, chills, fever, symptoms that are clinically indistinguishable from the flu, okay? Now, I talked a little bit about this, but let me share a little more detail about how the coronavirus is actually transmitted. So this particular virus is transmitted through air droplets. What do I mean when I say that? That means if you have this infection and you cough on someone, or someone coughs on you and they have it, or sneeze. So through coughing and sneezing, these viral particles go out into the air, okay? They don't live in the air forever, but if you are within a certain distance of that person and they cough and sneeze on you and then you breathe in, that's how it happens. And it can go into your eyes, your nose, your mouth, and then get into your respiratory tract, okay? It also can be spread through close contact. And this is through moisture, when people are talking and even breathing, okay? So, well, anyway, I won't share that. But anyway, when many of us talk, okay, some of us may spit a little bit. And, even if you don't see spit, there are particles and there are things coming out of your mouth. And I know this sounds gross, but I got to, share this with you all. So if you are in very close contact with someone, as they are talking and even breathing, that is another way that this particular virus is transmitted. And this virus spreads very easily from infected person to another person. Okay, it spreads very easily. And some are even hypothesizing that it may spread more easily than the flu. And you guys know how contagious the flu is. Okay, if you've ever had the flu, your whole household typically gets it unless they've been vaccinated. And even then, they may get a milder case. Okay, so it spreads very, very easily. Keep that in mind, because again, when we talk about prevention, we're going to share some tactics and some techniques and tips for you all to prevent that spread should you happen to be exposed. Okay. The other thing is that we really don't know how long the coronavirus lives on surfaces. We do know that, like all the other respiratory viruses, it lives for some amount of time on surfaces. And when I say surfaces, I'm talking about, countertops, telephones, door handles, things like that. But we don't yet know how long. Keep in mind, this is a novel virus, meaning it's a new virus. So it's still being actively studied. And while we know a lot, there's a lot that we still don't know. Okay. All right. So let's talk about prevention. What can you do to prevent from becoming infected with coronavirus? What can you do to prevent your loved ones, particularly your ill or your elderly loved ones, from being infected? Because I'm here to tell you, and I'm not trying to create, pandemonium and all of that panic. In fact, we really have to be calm. I should have started with that. We have to be calm. Okay. But this is a real threat. And while I live in Maryland, it is not, we don't have any cases here in Maryland. I'm knocking on wood. But chances are, based on what we are seeing, this virus is going to continue to spread, okay, throughout the United States and throughout the world. So you need to go ahead and begin practicing safe preventive practices. And this is not just for coronavirus. Honestly, these are things that we should all be doing every single day, and particularly during the winter, during flu season. So these tips that I'm sharing with you now are not just going to protect you from coronavirus, but from the common cold, from the flu, and from all the other respiratory viruses, RSV, okay? So the number one thing is frequent hand washing. Frequent hand washing. So I'm about to call y'all out. Those of you out there, you know who you are, who use the bathroom and don't wash your hands. SMH is all I can say about that. But you must wash your hands, okay? All of us must wash our hands. Frequent hand washing is the number one way to prevent transmission of not just coronavirus and some of the other respiratory viruses, but even the stomach bugs and things that we're not going to talk about today, okay? So how should you wash your hands? Ideally, you want to wash your hands with soap and water. I know that we have hand sanitizer, and we're going to talk about that in a moment, but ideally, nothing's better than soap and water. All right, so you want to start with some warm water. You want to get your hands wet. Then you want to put the soap in there and get a nice lather, and you should wash your hands for a full 20 seconds, all right? Common tip you'll hear in the healthcare community is to sing the happy birthday song twice, okay? If you sing the happy birthday song from beginning to end twice, that should be enough time for you to adequately wash your hands. So nothing irks me. Well, two things irk me when I'm in the bathroom, okay? One is when somebody uses it and walks out without washing their hands at all. The second is when I see women, obviously I'm only seeing women in the bathroom, putting the tips of their hands, tips of their fingers under the water, no soap, turn on the faucet that I have to touch, put their little fingers under it and do a little sprinkle and then walk out. I don't even know what that's about. That is not hand washing. You might as well not wash your hands at all, okay? You need water first, then soap, 20 seconds of vigorous washing all the surfaces, not just the palm side, but the backs in between your fingers, all of that, and then rinse, and then you want to properly dry, okay, with a clean paper towel preferably, okay? We're not going to talk about the air dryers, but dry your hands, all right? So that's the number one thing. Now, another thing that you can do to prevent transmission is to practice what we call respiratory hygiene or respiratory etiquette. What do I mean when I say that? Do not cough or sneeze on me or on anybody else. That drives me crazy, you guys. Yesterday, just as a quick aside, I was in the grocery store. I walked past the pharmacy, And I was there as the pharmacy was opening. I'm sorry, this is Saturday. And the woman, I don't know if she was a pharmacist or whatever, but she worked in the pharmacy and she was the one that was coming to open it up. And she's putting the key in to pull up the gate. And she's just coughing, not even bothering to cover her mouth. I mean, I was like, oh my gosh, she's going to be back there preparing people's medications all day. So you need to cover your cough, cover your sneeze. And you don't want to do it with the palm of your hand, because what's going to happen? All the germs are here. And then you're going to touch stuff and you're going to infect everybody else. Okay. So you cough into your elbow or sneeze into your elbow, or use a tissue and completely cover your nose and your mouth when you cough. Okay. And even then, I mean, I'm just a germaphobe. So even if I haven't coughed into my hand, after I cough or sneeze, I'm pulling out the sanitizer and I'm doing this. Okay. Oh, let me go back to the hand sanitizer. Sorry. That is a viable option if you don't have access to soap and water, but it needs to be a sanitizer with high alcohol content. Okay. All right. So we talked about frequent hand washing. We talked about respiratory hygiene. The other thing is to avoid crowds. So this is not the time, you all, to go to that sold out concert or to be somewhere, in a very crowded situation where there's a whole lot of people around you. And in fact, a lot of things are being canceled. And this is likely going to increase as the spread of this virus continues to increase, okay? But if you have the option, we're not recommending that you are in large crowds, particularly if you or your family member has any type of immune dysfunction, if they are dealing with cancer or the treatment of cancer. Even diabetes can weaken your immune response, okay? So if they're elderly, if they're frail, if they have a lot of chronic health problems, do not have them around large crowds at this time, okay? The other thing that we are recommending, not me, but the experts, is to avoid unnecessary travel, okay? And I don't know if the airlines and the hotels are making accommodations to individuals who already had scheduled travel. I am scheduled to travel next month for my birthday, and I am hoping and praying that this has blown over by then. But the experts are recommending that you avoid unnecessary travel. All right, now, what about in church? So I just attended church yesterday. I am a regular church goer, and I'm a member of a co-chair of our health and fitness ministry. And so our pastor reached out to us for advice. And there in many churches, including the AME Church, which is the large organization to which I belong, they are releasing guidance and information for pastors about conducting church services. But the bottom line is that we don't want you all holding hands, okay? So if you're a minister listening, please, at your church service, do not tell everybody to reach out and hold hands while they're praying. No, because we've already talked about how the hands are just, they're just germy, okay? So you want to avoid holding hands. You want to avoid a lot of hugging. And I'm a hugger, so I hate that. But yesterday we were encouraging people in church to do a, elbow tap or elbow bump instead of the warm embrace that we usually give each other during the designated portion of our church service, okay? All right, now what about cleaning surfaces? So in your home and also in your car, you want to clean the surfaces that are frequently contacted by those nasty germy hands. So things like door handles, things like the handle on the toilet, faucets in your bathroom, your countertops, things that people are touching frequently. You want to wipe those off. And ideally you can use like a bleach wipe, like I don't want to use brands, but a bleach wipe. You can also use alcohol. You can also use, soap and water, that is thought to kill this virus as well. But you want to wipe those surfaces frequently, especially if someone in your home is actively sick, with any type of infection, okay? The other thing you can do for prevention is to stay 4 to 6 feet away from people when you are talking to them. Now, again, most of us don't do that. And I have a couple of friends that, they just like to talk to you right up in your face like this. Just politely back up. If you have to explain, ask them to back up. That's fine. But 4 to 6 feet for somebody like me is like 2 arm lengths. Okay. So we're talking pretty far, but you definitely don't want to be talking right up in someone's face, and you don't want them talking close up to you, because again, we talked about how those particles will spew out of your mouth when you're talking. And if they have that infection, you will potentially become infected. All right. Another thing you can do, and these are things that I do anyway, because like I said, I'm a germaphobe. So, like when I am leaving the bathroom, I have a shirt, sweater, jacket, whatever I have on, I'm using this, and I'm, turning the door handle with that, or not, I'll pull my sleeve down and open it with my sleeve. So you want to avoid touching handles and things like that in public places, even handrails. If you are on an escalator, if you're going up and down stairs in a public place, don't just like slide your hand all the way down the rail as you are doing that. You want to really just avoid touching that. And if you have to touch it, or if your loved one has to touch it to maintain balance, then just make sure that they either put on their winter gloves and touch it that way, or like I said, pull their sleeve down or use their jacket or something else to provide that stabilization. Okay. And if you have to touch these things, wash. All right. The other thing is that do not touch your face with your hands. You all would be surprised. And this is something that my husband, as much of a germaphobe as I am, and I'm good at everything else, but I will admit that I am bad about touching my face. And for years, my husband has called me out on this. So you don't want to touch your face with your hands. Don't, and my eyes itch a lot. Now I'm getting a tissue and I'm rubbing my eye with the tissue. Okay. If I don't have a tissue, I'm using the inside of my jacket. Don't touch your eyes, don't touch your nose, don't touch your mouth. Just don't touch your face at all with your hands if you can avoid it at all. Okay. That is the most common way. You touch something where that virus is sitting, those infected particles, and then you go and touch your nose or touch your eyes, and then bam, you have now provided a portal of entry for that virus to get into your body. Okay. Now, many are asking about vaccines. As you know, vaccines are very preventable for some of our other illnesses. However, there is no vaccine in sight yet for coronavirus. They are beginning to work on it. Right now, they're saying it's at least 6 months, if not 12 months away. So we cannot depend on a vaccine right now to save us. All right, what else can you do to prevent yourself or your loved one from becoming ill? You need to get your flu shot, people. Now, I know it's March, and many of you are like, flu shots in March? Yes, flu shots in March, because the flu is still going around. And guess what? A whole lot of people have died from the flu too. So I'm not going to minimize coronavirus, but there are a lot of people that have died from the flu. And I wish that many of you would take that a little more seriously. All right, let me get off my flu soapbox. The reason that we are recommending that you get vaccinated for the flu is because, as I stated earlier, the symptoms of the flu and the symptoms of coronavirus are very, very similar. And so if you have gotten a flu shot and you begin to have some symptoms of the flu, again, it doesn't mean that you don't have the flu. It does, yeah, but it's more likely that you may have something else. Okay. And so and also it protects you against the flu. And so if you have good protection against the flu, then your doctor may be more likely to test you for coronavirus. Okay. Especially, of course, if you've had some type of exposure. All right. Now, what are some other just general things that you can do, that all of us can do and should do to prevent illness? These are general things. So we should be eating healthy, making sure that our loved ones are eating a healthy, well-balanced diet. We should be staying well hydrated, primarily with water. We should be getting adequate amount of sleep. Guilty, I don't do that. I'm going to try to do better. You can do better too. But get an adequate amount of sleep, okay, at least 7 to 8 hours per night. When you don't do those things, when you are not well rested, when you are malnourished, when you're dehydrated, that just puts your body in a state where it is more easily susceptible to become infected by these viruses, including coronavirus, okay? All right, so now let's switch over in the last part of this broadcast to talk specifically about some tips and to give you some information for those of you who are caring for individuals who are in a long-term care facility. Now, I'm referring to assisted living facilities, nursing homes, or rehab facilities, okay? Basically somewhere where they are in close contact with a whole lot of other people who can potentially be sick and who can potentially spread that virus. Okay, so if you guys think back to like college students, and you've probably all heard about outbreaks of meningitis among college students, and now there's a mandatory vaccine that is required for meningitis. Why are these things spread so easily? Why is meningitis spread so easily on college campuses? Because of that close proximity, okay? So the same thing happens in these long-term care facilities. In many cases, your loved one is sharing a room with nothing but a curtain in between them and the next patient. And oftentimes that curtain is open, especially if they've been there long term, because they may chit chat and, they're longtime roommates and they're social. And if they're not roommates with someone, there are common areas. They may eat in the dining room with the other nursing facility residents. They're going to physical therapy, occupational therapy, and these gyms where they're around a lot of other people. Okay, they have other community activities. So the two things that put these residents at significant risk are the fact that they're in close proximity to one another and the fact that they tend to be elderly and or sick, okay? So that is just a setup for the spread of any virus, and particularly when we talk about coronavirus, and I share with you how easily it's transmitted from person to person. So it's no surprise that there is an outbreak at this facility in Washington State. I can't remember now how many other people in that facility have tested positive, but I know it's in the double digits, and there are staff as well that are sick, okay? And like I said, this is bound to happen in other nursing facilities around the country. So I want you all who are caregivers to be aware. Now, I'm gonna post some links later in the comments, but the CDC actually has formal recommendations for long-term care facilities. And you guys know on Navigator Nuggets, I like to bring you all the inside information, because when you know what's supposed to be happening, then you can kind of be the watchdog and you can be the one to hold them accountable. So I want to let you know what's supposed to be happening in these long-term care facilities, okay? So one aspect of prevention is preventing the introduction of the virus into the facility in the first place. And the long-term care facilities have been advised to post signs at the entrance, on all of the entrances, advising visitors not to visit if they have symptoms of a respiratory infection. You all may be familiar with this in hospitals. A lot of times during flu season, there are significant restrictions on visitor policies. They often will not let children under 12, and they'll say if you're coughing, fever, don't visit. And many of y'all get upset because I've had so many parents, and as a pediatrician working in a hospital setting previously, people would be really angry when we would, have signs up telling them they couldn't visit. But this is for the protection of your loved one and the other patients, if we're talking about a hospital, or residents, if we're talking about a facility. So if you don't see any signs on the doors of the facility where your loved one is, you need to ask the director what's going on, because I know that the CDC is recommending that. The other thing is that they're recommending that these facilities ensure sick leave policies that allow employees to be off when they are sick. Now, you all, I'm gonna have to confess, and you all probably already know this, doctors and nurses are the worst. We go to work sick all the time, okay? All the time. And to be honest, I can only speak for as a doctor. I mean, you almost felt guilty if you were going to skip work for being sick. I showed up to work, you all, with a gallbladder that was inflamed and ended up being taken out the very next morning. I mean, I still went to work in severe pain, literally hobbling over, seeing patients until I couldn't take it anymore, and I got some coverage and walked my behind down to the ER. So that's just the nature of a healthcare professional. We are dedicated and we're a little bit silly, I guess you could say. But the point is, we want these employees to rest assured that if they are sick, that they should not come in, that there won't be any penalty, and that the facility will take on the responsibility of providing adequate coverage, okay? And then the other thing that they're expected to do to prevent introduction into the facility is to assess the signs and symptoms of infection, respiratory infection, among the residents who are coming in, okay? So when they are getting a phone call from a local hospital about a patient that needs to be transferred to their facility, there is a dialogue that is supposed to be happening that will allow the facility to determine whether this person may be at risk, okay? Whether they are actively infected with a respiratory infection, all right? And so, though I'm not saying that they're gonna decline all those patients, but they are gonna implement proper procedures to prevent that patient from bringing in, and exposing all of the other patients to those germs. All right, so that's the prevention measures to prevent it from getting into the facility. Then the next step is, how do you prevent spread within these long-term care facilities, okay? So again, according to the CDC, one of the things is that they are to keep the residents and the employees informed, Okay, so again, particularly if your family member is in one of those states that I mentioned earlier in the broadcast where we know that there is active infection, they should be getting some information about coronavirus and about what their facility is doing to keep them safe, okay? Also, these facilities are supposed to monitor the residents and the employees for fever or for respiratory symptoms, okay? And if they have it, they are supposed to be restricting residents with fever or acute respiratory symptoms to their room. They should not be going to the cafeteria or the dining area for their meals. And honestly, unless it's some type of life-threatening treatment, they should not be going out of their room for any type of medical therapy, okay? Unless it is life-threatening. So the physical therapy and things like that, it's important. But right now, if they are actively sick, that poses more of a risk to all of the other residents, okay? So they are supposed to be restricted to their room unless there is a medically necessary procedure. And if so, they are supposed to be a face mask is supposed to be placed on them, okay? Now, in general, for any residents that have an undiagnosed respiratory infection, meaning they have signs and symptoms, but it could be a cold, it could be the flu, it may be coronavirus, we don't know. The staff is supposed to use standard contact and droplet precautions, okay? And if they're directly interacting with them, they're saying to even consider eye protection, okay? Now, let me tell you what droplet, I told you all this is spread by droplets. So when the staff is interacting with someone who has an acute respiratory infection, they at a minimum should be, and this is really for everybody, standard precautions is you wash your hands before and after you touch a patient, okay? A resident or a patient. And so if you are in a nursing facility, whether it's coronavirus season or not, and the person, the nurse, the tech is coming in that room and starting to do things to your loved one, and you don't see them wash your hands, you are well within your right to ask them to please wash their hands. They should be washing their hands before they touch your loved one. After they do whatever care they provide, they should be washing their hands again, okay? And then if they are actively sick with a respiratory infection, they should be wearing a mask. This is at a minimum. Now, many facilities are going a step further, and with contact precautions, you also would put on a gown, okay? So you have gown, you have gloves, you have a mask, and you are washing your hands, okay? Before you touch the patient, and then after you remove the gloves, you are washing your hands again, okay? So you need to be looking out for these things, okay? And making sure that they are following these precautions. Again, the residents that are infected with respiratory illness are supposed to be restricted to their room. And so again, if you see somebody, a resident out in the hall coughing and hacking and sneezing, you need to say, hey, my understanding is that there are some guidelines, due to the coronavirus, and that residents are supposed to be restricted to their rooms. You're gonna have to be like the vocal caregiver, okay? And I've told you all this a million times, but you may have to be the watchdogs in this situation, because honestly, some of the smaller facilities and even some of the larger facilities may not be keeping up to date with the recommendations, or for whatever reason, they may not be implementing them like they should be, okay? All right, and then also the healthcare personnel are supposed to be monitoring their local and their state public health sources, because this is a fluid thing, as I told you all at the beginning, it is rapidly changing. They are supposed to provide support for hand and respiratory hygiene, so these facilities should have stocked up on gloves and gowns and masks and all those things. I will share with you, I have worked in a lot of hospitals in my day. I have seen healthcare providers put on a gown, for example, one of those yellow gowns, and they have worn that thing from patient to patient to patient, coming in a sick patient's room with respiratory illness, going into another patient's room who is not sick. That is wrong, you guys. If you see that, call it out. They are supposed to be taking off all of that stuff. We call it PPE, personal protective equipment. The gown, the glove, the mask, they're supposed to be taking that off, washing their hands, and then donning a new set for the next individual, okay? All right, so again, you all need to be aware of this. Now, in the nursing homes, there may not be, if there's not a sink readily available, then there should at least be an alcohol dispenser, and you should see that person vigorously washing their hands with the alcohol dispenser, all right? All right, so now lastly, what can you as a caregiver do? Whether your family member is living at home with you, whether they are living at home by themselves, or whether they are in a nursing home or a rehab facility, okay? the most important thing you can do, particularly for those who are living alone, is to check on them. If you are blessed and your elderly parent or your elderly relative is still able to live in their own home, check on them. Make sure that, call them a little more frequently. Make sure that they're feeling okay. Ask them if they're having any cold and cough symptoms. Ask them if they're having chills or fever and things like that. Very, very important. Make sure that they have adequate food and water. Now, I mentioned crowds. At some point, if this gets worse, it's not going to be all that safe to be in long grocery store lines and things like that, particularly in areas of the country where this may be spreading. So, I'm not trying to cause panic, but now may be a good time. I didn't say buy the whole store, you all, but stock up on some essentials. Make sure they have, food and things in their pantry. Fresh fruits and vegetables are best, but make sure they have things that are not going to go bad in case they are not able to safely leave their home for a week or two, okay? Plenty of food, plenty of water. Now, if they are on prescription medications, and this applies to you all too, you want to try to make sure you have at least a 30-day supply of all prescription medications. We just don't know what's going to happen, and you don't want to be in a situation where you've run out of a medication and for whatever reason, you or your family member can't go to the pharmacy and pick up that refill, okay? So make sure that there is a at least 30-day supply of prescription medications. Another thing you can do is that if you're sick, do not go visit your family member. Do not go to that nursing home. Do not go to that assisted living facility if you yourself are sick, okay? I know we like to visit our loved ones, but you are gonna do them more harm than good. So even if you just think you have a regular cold, the flu, stay home, wait until you have recovered. Because again, if you give that to them, you are now making them susceptible to a more serious illness, okay? And then for those of you who have family members who may have home health providers or, nursing aides that come to the home, reach out to their provider, to the agency, and find out what the backup plan is. What's going to happen if that person that usually comes to your mom's house 3 times a week or comes to your house, what happens if that person becomes ill? What is the backup plan? Okay, so just start to have those conversations, or you can institute a backup plan. If you and your brothers and sisters take care of your dad or your mom or your aunt, what's going to happen if 1 or 2 of you become sick? Because again, you don't want to be going over there if you're sick. So begin to institute a backup plan within your family if you all are the primary caregivers, okay? Just in case one of you becomes ill. All right, you guys, I hope this has been helpful. I know it went a little bit long. I am going to go back through and read through all of your comments and respond to them. But if you haven't already, just drop a comment to let me know that you were here. Let me know if this was useful. I sincerely hope that it was. Next Monday at 8 p.m. Eastern time, we're going to go back to, my plan is to go back to our regularly scheduled topic for the month of March. But, depending on what happens with coronavirus, who knows, I may need to do another update. Please share this video. This video is going to live on my YouTube channel. I'll put the link to that as well. But if you go to YouTube and search Your GPS Doc, you will find my YouTube channel. So this video will live there. It's going to be easier to find it there. But please like and share this video, and I will see you all next Monday at 8 p.m. Eastern Standard Time. Again, my name is Dr. Nicole Rochester. I am a board-certified pediatrician, a former caregiver to my dad, an independent health advocate, and the CEO of Your GPS Doc. I help family caregivers do 3 things: relieve overwhelm, reclaim their time, and ensure that their family members receive appropriate and effective health care. Thank you for those of you who made it to the end. Take care. Have a great week.